Hello guys, how are you doing? I'm Dr. Lázaro, board certified prosthodontist here at North Texas Dental Surgery in DFW area. So today I would like to introduce you to my favorite restoration in restorative dentistry, which is onlay restoration. I'm pretty sure that most of you are familiar with what a crown is. A crown is like a cap that covers the whole tooth. In order to do a crown, the dentist has to drill all around your teeth and at the top. Let me show you. So for example, these are fake tooth that has been prepared for a crown. In order to get a crown to sit onto the patient's tooth, we need to drill the tooth all around and at the top. What happens when we do a crown? Many of you have heard for sure that there's a high risk of sensitivity, or maybe that tooth need a root canal in the future because we're drilling out parts of the teeth that maybe have no disease or that need to be drilled away. In my opinion, the most important thing is to be minimally invasive and to try to keep more of tooth structure as possible, because we all know that what's gonna determine the long-term success and the survival of that tooth is how much tooth is remaining. That's why I'm a really big fan and I love onlays. What are onlays? So onlays, differently from a crown, we don't have to drill all around the tooth. Let's say for this kind of crown, if it's a zirconia crown, at least it needs to be drilled 0.8 to 1 millimeter all around and at the top. If it's a porcelain fused to metal, which are the old crowns that had metal at the bottom and porcelain at the top, it needs to be drilled around 1.5 to 2 millimeters all around. However, with onlays, we just have to drill the amount that it's necessary. Let's say a patient comes with a cavity or with a big old filling that needs to be replaced due to decay, or maybe because the filling is broken or need to be replaced. With an onlay, we don't need to drill all around the tooth if the tooth is healthy. We just remove the cavity, we remove the existing filling, and then we do a new ceramic restoration onlay. It's way more conservative. Let me show you a case I'm gonna deliver today. So this patient came with some existing restorations. This is the bottom jaw and this is the top jaw. Some of them were cracked and secondary decay, especially in the bottom left. So what I did, instead of drilling the whole tooth for a crown or a cap, what I did, I just removed the existing filling, the existing cavity, and I just prepared the tooth for an onlay. As you can see, this tooth at the front, the gray area, it means that front part of the tooth I have not touched, I have not drilled it. Same on the inside, what we call the lingual side. That doesn't look much here, but I can tell that's like 2 millimeters on this side and 3 to 4 millimeters on the front. So as you can see, I just removed the existing restoration at the top. I just reduced a little bit all around, 1 to 1.2 millimeters, and we fabricated this restoration that fits perfectly on top, no metal, only ceramic, and mimics perfectly the aesthetic. Every onlay has a different type of shape and geometry. So we just restore the part of the tooth that it's missing. That's why, for example, in this case, at the top, in the same patient, at the front, she had filling at the top and at the front, so I had to cover everything. That's why this patient at the front only covers more. However, on the inside, you see that I barely had to touch the tooth. If I had to prepare this tooth for a crown, I would have to have drilled all around with more risk of sensitivity, more risk of root canal treatment. However, there's one disadvantage of onlays, in my opinion. If we don't drill the whole tooth, there's gonna be a junction. And that junction is gonna be very well sealed. However, there's always gonna be an aesthetic concern. Me personally, I'm not worried when I'm working on posterior teeth, because we make sure that the color of the ceramic and the color of the patient's tooth is the same. However, some patients are aesthetically demanding. So there's another kind of restoration that's called a veneer-onlay, which not only will cover the top part of the tooth as with an onlay, but also the front part as with a veneer. So that restoration is also way more conservative than a crown, and it gives us an even better aesthetic result. It looks perfect like the patient's natural tooth. And as I told you, the most important thing is that we barely have to drill the patient's tooth. With these kind of restorations, on average, we have to remove 1 millimeter just in some specific areas. However, as it's ceramic and it bonded to the patient's tooth, in non-functional areas with the top, it's not what the patient chose. Let's say if it's at the front, like this case here, at the front we only drilled like half a millimeter, as if it was a veneer. So these are a very conservative approach, which has the goal of trying to preserve the tooth structure, try to preserve the vitality of the tooth, try to avoid root canals, and try to avoid sensitivity in patients' teeth.